All right, well, welcome everybody. Thank you for joining us today. My name is Andrew Dauphiny, and I'm the Instruction and Outreach Librarian at the New Jersey State Library. And our presenter today is Nicolette Vasco from the Alzheimer's Association New Jersey chapter. She's going to be talking to us today about really understanding what Alzheimer's and dementia is and being able to identify it and some steps to kind of deal with it. So a few housekeeping items before we start. There are some handouts associated with this presentation, and you can find them in the handout section of the GoToWebinar dashboard. If you have any questions, we will be taking them at the end of the presentation, so you can ask them using the question box that is also on the GoToWebinar dashboard, or you can email me at adauphiny@njstatelib.org. And we will be answering them at the end. There will be a survey associated with this. You should receive it at the end of the webinar and also in a follow-up email. If you could complete that, we would greatly appreciate it. We always value the feedback of our attendees. And if you're looking for more information about Alzheimer's or the Alzheimer's Association, you can visit the Alzheimer's Association New Jersey chapter at www.alz.org/NJ. So, and one more thing, for those of you not familiar with GoToWebinar, this will just be a quick tutorial for it. This is what your dashboard should look like. If you do not see this, look for this orange box with a white arrow. That'll open and close the dashboard, so it might be closed right now, and that should be either at the top left or right-hand side of your screen. If you have any issues and can't figure anything out, you can use this raise hand button, and I will get in contact you and hopefully resolve any issues that you're having. You can see here under handouts, we have 4 handouts for today, so you would be able to just click on them and download them directly from there. And if you have any questions at all under this questions feature, you can just type in your question and that'll be sent to us, and then we will answer it at the end. So without further ado, I will have Nicolette take over.
Hi, so my name is Nicolette. I work for the Alzheimer's Association, as Andrew said. My job is a program coordinator, so I deliver educational programs. I help with our helpline. So we do have a helpline that is 24 hours a day, 7 days a week, which is very helpful. If you have any questions, any comments, any information that you need, resources, we'd be happy to help through that helpline. It's great because when you just have a moment, there's always someone live available, which is nice. You don't get an automated system, and you can call at a time that's convenient for you. I train support group facilitators and community representatives. We're always in need of volunteers. So if you'd like to volunteer, we'd love to have you. And we teach educational programs, and this is a great program on understanding Alzheimer's and dementia. Oftentimes people think they're the same thing, and they're in fact not. So we'll talk a little bit about that. So getting started with this program, we'll talk a little bit about the objectives. So we'll compare Alzheimer's and dementia. We'll recognize how Alzheimer's disease affects the brain, list the risk factors of Alzheimer's disease, and identify those 3 stages of the disease. Recognize current FDA approved treatments that can address some of the symptoms of the disease, and describe how scientists are working to advance research. We'll name some resources available through the Alzheimer's Association. So I just listed a few, but we'll go over at the end as well some additional ones. And for anyone that missed any of those, I'll have them again on the screen. So first we'll talk a little bit about the impact of Alzheimer's. And in this presentation, there's a couple of clips that have questions. So if you'd like to, as Andrew has the chat, if you want to take a guess at the questions, that would be great. We can see what the majority consensus is and take that as our guess. So definitely an interactive program that's helpful. So this is one of the first questions, test your knowledge. So you can answer this in the chat. The first question being, how many Americans are currently living with Alzheimer's? So if you had to take a guess, would you guess 850? Would you guess 5.8 million, 12 million, or 3.4 million? So take a moment, take a guess. If you can put it in the chat, that would be great. And we can see what the thoughts are, and we can go with that. Any thoughts, any guesses?
We have two 3.4 million, one 5.8. So it looks like that's, so we have coming in another 3.4 million.
To rise to new. So there's a lot of factors within that. Unfortunately, we see a large population of people that are aging with Alzheimer's disease. Age is a big risk factor. And we know that people are living much longer, which is wonderful. We see sometimes in the news now people are living to 109 and 101, and that's wonderful. But unfortunately, our age increases, again, our risk factor. So we're seeing more people with Alzheimer's, with dementia. We know more, which is wonderful. You're on this program, you're learning more, people are hearing more, we hear it more in the media, people are talking about it. One of the things that I've found since I work for the Alzheimer's Association and I say, you know, what I do, people will say, oh, my aunt, my neighbor, so-and-so has been affected. So we all tend to know someone that's been affected now. And by talking about it and sharing, we're tending to see more people that are affected. It's not someone that we just think, oh, it's senility, it's hardening of the arteries, it's someone that's just aging, that's eccentric. We know it's something a little bit more. So education is a big key. And unfortunately, what we do know is that these are just the people that are diagnosed. These are just the numbers that we have that are reported. So I'm sure we all know someone as well who may need a diagnosis, who's never been diagnosed, never been to that doctor. So those are underreported as well. So the number is probably actually much, much larger than what we're seeing. These are just the projected numbers that we're aware of. We also have, as we talked about aging, we also see why there's such a large population of people aging at this time is because of that baby boomer era. We have a lot of that sandwich generation, that people that are aging right now. Over 65, we know increases our risk. 1 in 9 people are affected. But as we go over 85, our risk increases 1 in 3. So we know that, again, that age is a big risk factor, and we have such a large population that's aging at this time. So another question for you to take a guess. So how many unpaid Alzheimer's caregivers are there in the United States? So these are people that are not professionals. They're someone that's at home that's maybe caring for their spouse, their sibling, their parent, and they're working it. You know, they may have children at home they're still caring for. They may be working a job. They're those unpaid people that are caring for someone. We do know that a little tip while you're guessing this answer is that as care will increase as someone is going through the process of Alzheimer's. So I know that I can't stay up 24 hours a day and care for mom. So it may be not just me that's caring for mom. It's probably more likely me, my sibling, maybe my spouse. So a good guess would be, as we just guessed, over 5 million Americans are affected. So we know that the amount of caregivers are going to be higher because it usually requires more than one caregiver to care for someone. So if you had to take a guess, 1.2 million, would you say, are the amount of unpaid caregivers, 8.5, 13 million, or 16.2 million? So take a moment to take a guess. If you're able to write something in the chat, that would be great.
All right. We have 3 for 13 million. Somebody says 8.5 million.
All right, I'll try 13 million first. Unfortunately, that's incorrect. 8.5, unfortunately, that's incorrect too. And as I said, it's going to be a number higher than the 5 million. So process of elimination, it's going to be 16.2 million, which is shocking. 16.2 million Americans are going to be caring for someone. That's a huge number. And they're provided with unpaid care. So no one's paying you to care for mom or dad or your spouse. It's something we just do. We make it work. But very difficult and challenging. And also we know the cost of care is so high. So people need help. Really important that we're advocating for our families and people. So a little clip on knowing the facts on Alzheimer's disease. So that's a little bit of information on our facts, our figures. One of the handouts that Andrew posted is information on our facts and figures. We update every year the numbers that we're aware of, again, those reported numbers and projected numbers based on them. We do have facts and figures for in the state of New Jersey. We also have it for throughout the country as well. And now we'll talk a little bit about Alzheimer's and dementia. As I said, unfortunately, sometimes people get confused the two, think they're the same thing. We'll talk a little bit about the differences. But first we have another test your knowledge question. So this is a true false question. If you want to take a guess again in the chat, the question is, Alzheimer's is a normal part of the aging process. Do you think that's true? Alzheimer's is normal, or false? It's not normal part of the aging process.
All right, we have a few falses. One person says true.
All right, we'll try false first. So false is correct. So Alzheimer's is not normal to age. Just because we're aging, we shouldn't develop Alzheimer's disease. It's actually a brain disease, and it causes problems with someone's memory, with thinking, with behavior. As I said, it's not a normal part of aging. Unfortunately, in the media, a lot of times we just see it portrayed as someone with difficulty with their memory. You'll see them repeating themselves, which is something that we do notice with Alzheimer's disease. And it's probably the most frustrating, the most common thing that we see. But Alzheimer's disease, unfortunately, is a progressive disease. So it's going to affect so many different areas of the brain. And everyone is very different in their journey. So it could affect hearing, it could affect balance, it could affect thinking, someone's behaviors, their actions, their speaking, their writing. So all different areas could be affected, and very difficult, and not something that we want to attribute with our aging process. We want to avoid, of course, brain diseases. And another true false question. So people younger than age 65 can get Alzheimer's. Do you think that's true? If you want to say true, that it is true that people younger than 65 can get Alzheimer's, or do you want to say that's false? People younger than 65 cannot get Alzheimer's disease.
A lot of people are saying true.
It is true. That's correct. Good one. So actually, my own grandfather, my mother's father, both of my grandfathers were affected, but my mother's father was in his 40s when he was affected. And there are a lot of people that are in their 40s and 50s. So approximately 200,000 Americans under the age of 65 are living with younger onset. So we call younger onset, again, are the people under 65 that are affected. In some cases, they could develop this disease, as I said, in their 40s and their 50s, and it brings about a whole different set of challenges. Alzheimer's disease is challenging at any age, but if we're still working, if we haven't retired, if we have young children, we have to explain this to right now. Maybe someone in our family, my mother's father was the breadwinner. He was the only one working. He had a young child who was about 10. So definitely brought about a whole different set of challenges, and can be very difficult advocating for someone that's under 65 because it isn't as common. Doctors may not immediately think of Alzheimer's disease. Someone may go misdiagnosed or underdiagnosed. Also advocating for the financial aspects and the legislation that may help someone. There's an Older Americans Act that we've been working with, trying to change over the past year, because it didn't include people under 65 that were affected by Alzheimer's, and they deserved any kind of help they could get as well. So really important. Again, people under 65 can be affected, and that we try and help them as well, and they're included with any kind of assistance that everyone else is getting. So now we're going to hear from one of the experts.
Dementia is the umbrella term for an individual's changes in memory, thinking, or reasoning. There are many possible causes of dementia, and Alzheimer's is the most common cause. Other causes of dementia are vascular dementia, which is marked by changes in the blood flow in the blood vessels in the brain. Dementia with Lewy bodies, identified by specific brain changes throughout the brain that include the buildup of a protein known as alpha-synuclein. And frontal temporal dementia, which is marked by brain cell loss in the front sections of the brain or the frontal lobe. Each type of dementia may have distinct characteristics to cause specific behaviors in the individual, but there is also some overlap in behaviors among the types of dementia.
So as Dr. Heather said, so Alzheimer's disease is the most common type of dementia, but she showed an umbrella, and it is dementia is more of that umbrella term. So we tend to think of it, I use the example of the word flower. So flower is an umbrella term. It includes so many types of flowers. We have roses, we have daisies, we have tulips, we have petunias. I'm sure I could go on all day. And flower is the broad term, like dementia, but Alzheimer's may be the rose. It's the most common type. It's the one we think about. So oftentimes why people attribute the same thing, but there are many other types. So just like there's many other types of flowers besides roses, we have many other types of dementias. There may be 90 other types. We have vascular dementia, which is very common when someone has had difficulty usually with their heart, and they've had a lack of blood flow to the brain. And during that time period, it's caused some types of cognitive impairment. We have mixed dementia, which is usually a combination of Alzheimer's and another type, usually vascular. We have other types that may be attributed to how someone acquired it. There's dementias that usually is acquired by someone drinking too much. It may be also how the symptoms that someone has. So there's certain types of dementia where someone's hallucinating more. They may be acting out their dreams. So it could be the type of dementia could be based on the symptoms, how they acquired it, many different factors as well. There's also sometimes some overlapping factors that you see commonalities. We recently changed our mission. So our mission used to be to end Alzheimer's disease. And now we've changed it to Alzheimer's and other dementias, because we realize that people need help, and there's many factors that overlap, and we want to help. We want to be part of the end to those diseases, and we want to be able to provide care and support and resources to people. So now we'll see a clip. Why is it important to get an accurate diagnosis?
Certainly having the diagnosis of Lewy body was helpful in our planning, because we began to understand where this was coming from in the brain, where otherwise we would not have known. Like we knew something was happening, but what was it? To give it a label actually helped, although it was a big umbrella. It explains some of the characteristics and symptoms that we were experiencing and seeing.
So really important we get that accurate diagnosis. For resources, sometimes someone will say to me, well, we know there's a problem, what's the point? So I often compare it to, if I have cancer and down the line I need chemotherapy, I need radiation, what have you, the doctor's not going to just give it to me unless I have the testing, I have the diagnosis of cancer. Well, with Alzheimer's disease, someone may need additional medications, they need additional support, maybe they need care in home, out of home, maybe they need a wheelchair or a shower chair, they need additional help in various ways, and that may not be covered unless they have a diagnosis. So again, really important getting that diagnosis for financial reasons. It could be for healthcare reasons. It could be for someone that is saying, what's wrong? I noticed something wrong. If usually in an early stage, maybe someone's noticing something and they're thinking, what's going on here? And knowing what is going on is important. Maybe they're past that point where they know something's going on, but it's important to you as well to know how to provide care and get that support and resources. It's also really important because there is a variation in those dementias. So if I don't have Alzheimer's disease, but I go on an Alzheimer's drug, and I have one of those types of dementia that has hallucinations and has acting out my dreams, that could become worse if I'm on the wrong type of medication. So we want to make sure that everyone gets an accurate diagnosis, and usually that involves varying different degrees of testing. Usually there's not a be-all, end-all test, and really that's important for an accurate diagnosis. We don't want someone to say, get a diagnosis of Alzheimer's disease and they have a urinary tract infection, or they're dehydrated. There's many things that could mimic Alzheimer's disease. They're having a stroke. They have a blood clot. So we want to make sure that someone's getting that accurate diagnosis and they're getting treated properly. So a recap of this area, the Alzheimer's and dementia. Dementia is a general term for the collection of symptoms that are severe enough to interfere with someone's daily life. I teach a class on the 10 warning signs, and we talk about, again, the difference between I walk in a room and I forget something that's irritating or something that's interfered with my daily life. I go to a store and I can't remember how to get home down the street. Very different than I walk out of the store and I say, where did I park? I was distracted when I came in. I wasn't paying attention. That's annoying, but it's not interfering with my life. Not knowing how to brush my hair, tie my shoes, read a book, be able to do certain functionalities, that would interfere with my daily life. So very different, those severe symptoms. Alzheimer's disease is the most common type of dementia, and it is not a normal part of aging, as we talked about, and it's a progressive brain disease. So now we'll talk a little bit about Alzheimer's in the brain. And hearing from another expert.
More than 100 years ago, Dr. Alice Alzheimer described specific changes in the brain, what we call the formation of plaques and tangles. Now, Alzheimer's is a progressive brain disease that's marked by these key changes and is thought to impact memory, thinking, and behavior. The brain has three main parts: the cerebrum, the cerebellum, and the brainstem. Each one plays a role in how the body functions. The cerebrum fills up most of your skull. It is part of the brain most involved in remembering, problem solving, thinking, and even feelings. There are about 100 billion nerve cells or neurons throughout the brain that transmit messages in order for us to create memories, feelings, and thoughts. Alzheimer's disease causes nerve cells to die, which leads to the brain tissue loss, or what we call shrinkage, and causes loss of function and communication between cells. These changes can cause the symptoms of Alzheimer's disease, such as memory loss, problems with thinking, planning, behavioral issues, and even at the end stages, problems with swallowing.
So as the doctor said, more than 100 years ago, Dr. Alice Alzheimer described specific changes in the brain, these formations of plaques and tangles. So oftentimes there's the misconception I'll hear. Someone will say, well, it's relatively new, Alzheimer's disease. It's actually not. So it is more than over 100 years ago. But as I said, we're living so much longer now. There's more of a focus. So unfortunately, Alzheimer's disease is kind of a little bit behind the 8 ball when compared to some of the other, top 10 diseases. Heart disease, we know so much more. People can have operations, they can be on blood pressure medications, they can have stents in their heart. Cancer, we can have chemotherapy, we can have radiation. We've come a long way. There's lots of trials. A lot of these top diseases have come much further with treatments and options for people because, again, it kind of wasn't as much of a focus because it was more rare. People weren't living as long, not as many people were affected. Today we're seeing it much more, we're talking about it much more. And again, that education piece, we know that it's not typical aging. We know something's not quite right. Those formations of plaques and tangles is what we're seeing in the brain. And even recently, we're always finding out more information about research. Recently, we just got an update, I believe this week it was, that PET scans that we're showing now through PET scans, it's helping through diagnosis, that it is a way to see in the brain those changes that are going on. And we're working hard now to, again, have that approved more with medical plans, because we know that, you know, certain things may not be covered based on insurance plans, plan to plan. Knowing now that it's a good way that we can help diagnose someone. It's not the be all end all. Again, really important we go through all the different testings to rule out other things, but we know now that PET scans, just recently, that it's another great form to help us with diagnosis. Alzheimer's disease causes nerve cells to die, which leads to shrinkage in the brain. So unfortunately, these nerve cells are the connections throughout our brain, our body. When I walk, when I talk, when I think, I have memories, behaviors, that's all coming from my brain. And when these nerve cells are died, when they die, unfortunately, they're causing these brain changes. So that's when I see I'm having difficulty thinking or remembering certain things. My behavior may not make sense as to what it always was. I may be acting in different ways or having difficulty with certain tasks because those nerve cells are the connection throughout my body. And when they're not working properly, it's hard for everything to work properly. So the next area we'll talk a little bit about is those risk factors. And another test your knowledge question. So if you want to take a guess in the chat, the question is, what is the greatest known risk factor for Alzheimer's disease? So the first option is genetics, the second is family history, and the third is age. Now I caution that all those answers are risk factors, but the question is, what is the greatest risk factor?
All right, we have one person has genetics, two people say age, someone says family history.
All right, so we'll go with age first, since a couple of people had that answer. And that is the correct answer. So as I said, all these risk factors, all these are risk factors, genetics, family history, and age. But age is the greatest. And although Alzheimer's is not a normal part of aging, age is the greatest risk factor for the disease. And after the age of 65, the risk of Alzheimer's doubles every 5 years. And 32% of people age 85 and older have Alzheimer's disease. So very scary high numbers. We hope to live these great long lives, but we know, unfortunately, our risk does increase as we're aging. We know that, unfortunately, all three of these options are not preventable options. So my genetics, what I'm born with, is what I have. My family history, as I said, it runs on both sides of my family. That could be a factor, unfortunately. And my age, as I age, you know, my risk increasing. But we talk also, I teach a healthy living, healthy habits class. We're actually teaching it this week, 9 a.m. on Friday. So if you're available and you'd like to join us, you can go to our website, or you can go to our helpline and sign up. And again, I will have those at the end of the presentation posted, so that way you can write down that information if you'd like to sign up. But that healthy living class, I really talk a lot about the risk factors that we can control. So unfortunately, we can't control these things, but I can control my exercise and my diet and nutrition. I can control my social engagement with others, and my cognitive stimulation, so those things that challenge me. I can control that I wear my helmet when I go bicycling, and I protect my head by wearing my seatbelt, by my good heart health, so protecting my heart protects my head. So doing all these preventative things that we talk about in that class a little bit more, how to incorporate them into your life, they can really help your chances. They can help your prevention and your risk factors. Unfortunately, these three are not ones that I can change. I wish I could, but knowing that they are a possibility. Also knowing that they're a lower possibility. So my family history, my genetics, my mom often says, well, my dad had it. What if I get it? We can worry about that all day, but it's not going to change the family history. But what she can control are those other variables that I talked about. So those are the things that we want to focus on, not worrying about, the uncontrollable. So now we'll hear a little from another expert.
Alzheimer's disease is marked by specific brain changes that result in the clinical changes in individual experiences. That is, changes in memory, thinking, or reasoning. And ultimately, Alzheimer's is fatal. The exact cause for these changes is unknown, but there are some hints as to what may contribute to an individual's risk. Age is the greatest known risk factor for Alzheimer's. And when we look at populations of people, we see an increased risk over the age of 65. However, Alzheimer's is not normal aging. Family history is also a known risk factor. Research has shown that those who have a parent or a sibling with Alzheimer's are more likely to develop the disease, and that risk increases if more than one family member has Alzheimer's. When we talk about the genes involved in Alzheimer's, there are two categories that could potentially be involved: risk genes and deterministic genes. Risk genes increases an individual's risk for developing the disease, but does not guarantee that they will develop Alzheimer's. Deterministic genes, which are rare for Alzheimer's, guarantee that the person will develop the disease.
So we do have those two different type of genes, and I talk a little bit about, we know that the gene most of the time we're seeing, it's called APOE4 gene, but there are other variations of it as well. And that gene, most of the time we're seeing correlates with Alzheimer's disease. We know that, again, that age is a variable. And as she said, there's that difference between the deterministic genes and the genes that are not. The deterministic genes, for example, if I have Huntington's disease, I've acquired that. Huntington's comes from other members of your family. It's family correlated. That's how you get it. If you have the gene, you have Huntington's disease. Vice versa, breast cancer is a good example of something that's not deterministic. So I may have the BRCA gene, oftentimes we hear about that, and that may increase my risk. It may put me at high risk, but it doesn't necessarily mean that it's going to carry out. Alzheimer's disease is a lot like that, where in the way I may have the gene, I may have gotten it as it runs in my family, that increases my risk. I could live my whole life with the gene, pass it on to my children, maybe not, but never develop Alzheimer's disease. Vice versa, unfortunately, we're finding that people that didn't have it in their family history, and as they're aging, they develop Alzheimer's disease. So something that is a possibility as well. We do see that there are populations at higher risk. So Hispanics are 1.5 times more likely to develop Alzheimer's disease. African Americans, about twice as likely. Almost 2/3 of Americans with Alzheimer's are women. So really important, all different populations get involved in, we have a trial match program. We talk a lot about trials. I'll go further into that at the end of the program, the trial match program. Really important, because if we're only studying the genes or the treatments or the preventions, all the different aspects of getting to the bottom of Alzheimer's disease, only in one population, white males, that's not helping everyone else, because we don't know, we're all different. There's different genetics between men and women. There's differences we're seeing in ethnicities. Why is that? So a lot of research is going on in all different areas, and really important people get involved in those trials, in that research, so that we can find the answers and we can help everyone. So the risk factor recap, so age is the greatest risk factor. We see an increase for people that are over the age of 65, and family history, unfortunately, is also an increased risk factor. When we have a parent or a sibling with increased with the disease, it does increase our risk. I talked a little bit about those risk genes, the things that put us at risk, and those deterministic genes, the ones that say that we are determined, we have it, the gene. There are two types of genes. Those are the two types. And then, as I said, different populations are at an increased risk for Alzheimer's disease. So there are different stages of Alzheimer's disease, and that's what we'll talk a little bit about next. So the question posed was, does everyone living with Alzheimer's experience the same early symptoms? So we'll hear a little bit a little bit about that.
One of the things that impacts our brain is all the other things that can happen to us as we age. And we know that Alzheimer's, the most common risk factor for getting Alzheimer's disease is age, but we also have lots of other things that go wrong with us as we age. And so how those other health factors impact our brain can also impact how Alzheimer's presents in other people.
So Alzheimer's disease, what does living with Alzheimer's disease feel like? So now we'll hear a clip, 4 clips from different individuals, what it feels like for them, because we know that Alzheimer's is not the same for every person in the journey. So what does it look like? The first clip will describe a different kind of forgetting.
It's a different kind of forgetting. It really, really is. It's not just forgetting where I put my car keys. It's much deeper than that. And for example, I cannot read a book. I used to be a voracious reader because by the time I turn a page, I have forgotten what I had read. And if you're reading a novel, you have to know what transpired before it in order for you to continue to read on. And so I can't read a novel. So I've even stopped trying.
Next, someone will speak a little bit about losing the words, the difficulty.
Math, I can't do a simple tip anymore. You know, I sit there, I stare at it. It's crazy what numbers I can't deal with anymore. And in some ways, that's the disease to me. The other thing that I've increasingly been struggling with are words, which I've dealt with words my entire life. You know, as an avid reader, as a reporter, as a writer. I struggle with them now.
And Phil actually is a great partner who came to one of our walks in New Jersey several years ago, and he also has younger onset, and he talked about being at the age where he had all these plans and all these trips he was going to take and all these things he was going to do in his career, and he's a professional writer, and he talked about, again, having the difficulty finding these words and coming to grips with, he knows what the future looks like and how there is going to be a decline and how difficult that can be. Facing the frustration, the next clip we'll talk about.
I'm like an overachiever. And when you're unable to deliver or you're not performing at the same pace that you once did before, that's frustrating. It's frustrating to not know where you place things. It's frustrating to not be able to explain to someone the problems that you're having. You can't articulate it in a way. It's frustrating to read something and you forgot what you read. It's frustrating to continuously have to change your password and you just changed it last week and you're constantly doing the same thing over and over again.
And finally, we'll hear a clip about living for today.
I think the thing that surprises me the most about my dementia is that it is progressive. And and I'm finding that I'm forgetting more. And they do memory tests for me all the time at the doctor. And so that becomes a little disconcerting at times, to see my cognitive impairment continue to decline. But again, I really have hope. I don't live really in the future. I can't live in the future. I can't worry about what the future is going to bring. I have to live for today.
So again, that important living for today, taking those trips, making that time, even talking about healthcare options and financial options and decisions that may not be today, but somewhere down the line, really important to think about and talk with someone about. Sometimes we don't want to think about what comes down the line, but so important because in an early stage, someone can have that input, someone can make that decision, someone can execute their wishes and put them in writing. At a later point, whether it's healthcare or financial or driving or where someone lives, we're going to be making a decision for someone in a later stage. So really important we have these discussions early and we're able to talk to someone about what it feels like and what their wishes are. Now we'll hear from another expert.
Alzheimer's affects everyone differently. As a result, it's difficult to place a person in a specific stage of the disease. However, there are 3 general stages that are commonly referred to as early, middle, and late stage Alzheimer's. In a medical context, you may hear these stages referred to as mild, moderate, and severe. In the early stage of Alzheimer's, an individual may be able to function independently. However, they may start noticing more frequent memory lapses. Friends and family may also begin to notice difficulties in the person, and a healthcare provider may be able to detect problems in memory or concentration by conducting a detailed medical interview. Middle stage Alzheimer's is typically the longest stage and can last for many years. Damage to the brain cells can make it difficult to express thoughts and perform routine tasks, and this can lead to increased feelings of frustration and anger. In the final stage of the disease, an individual loses the ability to hold a conversation, control their movements, or respond to the environment around them. Cognitive skills, that is their memory, thinking, and reasoning skills, continue to decline, and this can lead to personality changes and need for round-the-clock care.
So as was discussed a little bit about that early stage, it usually tends to be where we're not quite sure. We may not be seeing changes all the time. We say, they're a little more forgetful, or maybe someone notices, I'm having trouble with a certain task or remembering certain things, but maybe it's not all the time. Maybe it's not all of the symptoms. So a lot of times someone may go underdiagnosed, but really important, again, when we're noticing any changes in concentration and functions and abilities, something that I've always done. It's not a new task like programming your DVR or working new technology, but something someone's always done, paying bills, going to ShopRite, and they're having trouble doing that. It's really important we go to the doctor, we get it looked at, we find out what's going on. In that middle stage is usually where we're seeing something a little more consistently. We're seeing maybe confusion with those words. Oftentimes here is the longest stage in the middle stage. And again, everyone goes through the stages at different rates. Oftentimes that may be determined by underlying factors, other conditions someone has. But in that middle stage, we're seeing more consistency of symptoms, probably more of them, changes in behavior. So oftentimes someone may be a little more aggressive. They're saying things they may not have in the past. They're having difficulty much more with memory. They may be repeating themselves much more. In that later stage is usually where physicality may start to take a decline. So we see someone losing a lot more weight, maybe not wanting to eat. They may eventually be bedbound, incontinent. So definitely thinking about when someone needs 24-hour care and assistance and things possibly down the line, what is the plan for that? How are we going to get help, whether it's in home or out of home? It's a very personal decision, but what does that look like? And also, I always recommend coming up with a B plan. So my A plan may be, I'm going to care for mom at home every day, and that's what I'm going to do. But if mom develops pneumonia, if she needs nursing, what is the plan? Is someone going to come home, come to our home? Will she need to be in a nursing facility? Which nursing facility is it? I would always recommend having that backup plan because things creep up, things happen. My own family, as I said, both sides have been affected. My father's side, more recent. And we went through last year where we had to find a location where my grandfather could stay. He couldn't, the physicality, my grandmother couldn't care for him around the clock care anymore at home. That was her plan. That was her A plan, but we didn't have that B plan. So when he had to get released from the hospital, we were scrambling. Where is he going to go? Within 24 hours, a decision had to be made. He was getting released from the hospital. So please look at a B plan, even if that's not ideal for your family, because you don't want to be in the position we were where you have to make a split-second decision. You always think, you know, was this the right decision? You know, would I make it the same decision? Is this what he wanted? Different variables came up and we had to make the decision for him. So really important, again, thinking ahead and coming up with different options. So the stages of Alzheimer's disease recap. We talked about there's 3 stages. They tend to be early, middle, late, or sometimes they're called mild, moderate, severe. No 2 individuals experience the symptoms or the progression in the same way. And while symptoms worsen over time, people progress at different rates and their abilities change at different times. Now we'll talk about the FDA approved symptoms. So another test your knowledge question, if you'd like to answer in the chat, a true false question. So if you had to guess true or false, there are several drugs available that slow down the progression of Alzheimer's disease.
We have a half and half true and false right now.
All right. So let's go with true, and that's incorrect. So the answer is false. So there are currently no treatments to prevent, treat, or slow down Alzheimer's disease. So unfortunately, as I said, there's lots of research going on, and we need more participants, more people willing to get involved, but we haven't got there yet. What we do have is several drugs that are available to help address some symptoms. So what we notice is that the medications out there that are for people with Alzheimer's disease, some of the common names you may have heard, Aricept, Namenda, Presidine, they help with the symptoms. So today's a good day. My symptoms aren't as bad. Unfortunately, it's not preventing Alzheimer's. It's not treating me. It's not slowing it down. But today's a good day. I'm managing my symptoms. Those medications, they work off of the nerves. The nerve cells that I was saying in your brain send those signals. Unfortunately, once that nerve cell stops working in the brain, the medication may not be as effective. So again, really important early diagnosis because someone has more possibility of those drugs working for them early on. If those nerves are still sending the signals, they're working when I take that medication, today is a good day. Everyone wants more good days. So really important, again, early on, going to the doctor, finding out what's available and what can help me in this stage that I'm in. So now we'll hear a little bit from the expert about those medications.
There are currently several drugs that are FDA approved to treat the cognitive symptoms associated with Alzheimer's disease. They treat the symptoms, but they don't treat the underlying cause. So eventually people will progress, but they do treat some of the symptoms and help people for a time. So the first class of drugs are cholinesterase inhibitors. These drugs work to prevent the breakdown of acetylcholine, which is a chemical messenger found in the brain that's associated with learning and memory. There are 3 FDA-approved drugs that are in this class of drugs. There's Aricept, there's Exelon, and there's Razidine. There's another class of drugs that's modulates glutamate, which is another chemical messenger in the brain that's associated with learning and memory. And this drug is called Namenda. And then there's a final class, which is actually a combination of cholinesterase inhibitors and glutamate modulator, and this is called Namzaric.
So what we are seeing is that oftentimes now people are on maybe an Aricept and Namenda, or they're on a Namzaric. Oftentimes this may be because the brain works in different ways and the medications work in the brain in different ways. So knowing that some may help with information processing, some may help in another area, there's more of a possibility it may be helping, it may be working off of the different nerve cells that are still working for someone. Everyone, again, is different in the progression. So Aricept may work for one person, Namenda may work better for someone else, the combination drug may work better for someone else. It's kind of more what we're expecting, these combination drugs, when we do find the prevention, the cure for Alzheimer's disease, something that slows it down. It's probably going to be something more of a combination drug, like we see with the AIDS-related drugs or we see with chemotherapy. It's probably not going to be a drug that falls out of the sky. And again, that could be because of the different ways that it works inside of the brain. The FDA approved treatments, so the recap, so these are types of drugs approved by the FDA. So that means they've gone through trials, they've been tested on a population of people, there's research behind them. And these are, again, your inhibitors, which is Aricept, Exelon, Razidine, your modulators, or sometimes we call them MMDA receptors, that's your Namenda. And then your combination drug, which is your Namzaric. These address symptoms in some people. So the results vary person to person, again, based on their progression and what works for each individual. But they unfortunately don't treat that underlying cause. There is advancing Alzheimer's research. So great things we're finding out every day about the research. So now a few clips about investigating early intervention.
This is an incredibly exciting time in Alzheimer's and dementia research. The advancements that we've made in the last decade to understand the disease as a continuum, meaning that the biological changes are starting a decade or more before someone is experiencing the changes in the memory and thinking. This sets the stage for possible prevention. The idea that when we have the tools to identify those individuals at the earliest time point, and when we have the interventions to target individuals at that earliest time point, we can intervene to stop or slow the progression of the disease before an individual loses their memories.
Next, we'll hear about those lifestyle factors. So these were the things that I talked about earlier, the controllables.
I'm excited about what we're learning these days regarding lifestyle. One of those things that we've seen in the past of things like exercise and nutrition have now started to gain more momentum to indicate to us that it can change your ability to slow cognitive decline. That is really the first stages of Alzheimer's disease. This may include things like social engagement, mental cognitive training. It can be things such as exercise. It can be nutrition. All those things are now starting to point that they will lower your risk for Alzheimer's disease.
Now a little bit about moving towards the cure.
A lot of hope does come from the Alzheimer's Association, all the research that is being done. Even though there is not a cure today for the disease, I know in my heart there is going to be a cure one day. And I know we're getting closer for that cure.
Because even if you fail in a research study, you learn from that failure in the research study. That failure always brings progression.
And then we'll hear about securing the funds.
It's nice to see the association spearheading in many ways the emphasis on getting the money at the federal level and at the private sector to get the research done so that someday there will be an effective treatment, hopefully cure, hopefully prevention.
So all things very important to us. And a little bit about, so I talked about the clinical study. So we're wrapping up some of the factors that I talked about that I said, oh, we'll get to that at the end. We're getting to the end now where I'll talk about those things. So the first was clinical studies, which are the key to advancing Alzheimer's research. So oftentimes clinical studies, we hear that people do better in them. And it's not necessarily all about the medications, but it's that oftentimes I hear when people go to the doctor, someone will tell me the doctor said, I'll see you in 6 months. And the person's kind of spinning. What do I do? Where do I go? How do I get help? In this clinical trial, they're going to be checking in more often. They want to know how you're doing because they're trying to find the cure. Also, those clinical studies are the only way, again, we're going to get to the cure through the research. So really important people get involved. And here's 2 clips about them.
It's more important than ever for people to participate in clinical studies. The fact is, right now, we don't have an effective treatment to stop Alzheimer's disease. And if we don't have people participating in clinical trials, we never will. And so participating in a clinical study is one way that everyone can get involved in a very direct way in the fight against Alzheimer's disease. And for people who currently have dementia or Alzheimer's disease, there are some additional benefits. You get access to very close medical care. You also may be among the first people to have access to the treatments that will eventually prove to work.
Sometimes you hear the phrase, it's a failed trial. That means that it didn't hit the endpoint, it didn't achieve an FDA-approved drug. But I would say as a scientist, the only failed trial is one that doesn't give you valuable information. And if the trial is well designed, if it is a good scientific experiment, you get extremely valuable data so that you can plan the next trial and do the next study even better than the last one. And it gets you that much closer to that FDA approved drug, to that effective treatment, and maybe someday even a cure.
Currently, more than 5 million Americans are living with Alzheimer's. By participating in clinical research, you can move us toward methods of treatment and prevention for all those affected by this devastating disease. Alzheimer's Association Trial Match is a free clinical studies matching service for those with dementia, caregivers, and healthy volunteers. To start, simply create a confidential user profile and receive a list of studies that may be a match for you. Don't just hope for a cure, help us find one.
So the trial match is, as she said, free, one of a kind. It's a matching service. I did it myself, very easy. You can call, you can go online, you answer about 5 questions, your age, your race, your gender. Do you have Alzheimer's? Does anyone in your family have it? And it will give you the matches of clinical trials that you qualify for. The nice thing is it's no obligation. I did it over a year ago and no one calls me, hassles me, and says, when are you gonna call us? When are you gonna get involved? It's totally up to you. It's also, as she said, for people that are healthy, for people that are diagnosed, and there are also drug trials and non-drug trials. So a lot of research on prevention we're finding now. So not all, sometimes people think, oh, I don't want to take another medication. Not all trials are medication bound. So really important to find out about the research, how to get involved. The recap of this area is we've increased our understanding significantly over the past decade. And as I said, many different people can get involved in these clinical trials to help us find prevention, treatment, and ultimately the cure. You can get involved online or through calling our 1-800 number. And now finally, the last piece on the Alzheimer's Association. So we are a nationwide organization, and our vision, as I said, we've changed to a world without Alzheimer's disease and other dementias, because we want to help as many people as possible. This is our 1-800 number, so 1-800-272-3900. 24 hours a day, 7 days a week, someone will answer the phone live and helpful. We're a nationwide organization, so we help people across the country. Our programs, our services are the same. So if you have family members elsewhere, especially now that we've been virtually, we've had a lot of people on our calls for New Jersey that have hopped on from Florida. Last night we had a woman from Maryland and New York. We've had people from Georgia throughout that just need help. So if you check our website, and that is alz.org, you can log on to our community resource finder. I'll cover that right now to give you information how to find those resources. So first is a clip on the helpline.
I've had a couple of phone calls that I've been able to make in to the call center. When I've had a couple of quick questions that I wanted to ask, there's been a couple of nights, 2 o'clock in the morning, you have questions, you have anxieties, and I was struggling dealing with them, and it's amazing. It was one of the best things I ever did, was keeping the call center on my favorites now. Just to know that there's somebody you can call who is aware of what you're going through.
Even if you want resources sent to you, we're happy to do that. You want to vent, we're here. So 24 hours. I've never heard a bad thing about the helpline. A great place to get resources and information. We're also online, alz.org.
When I went to the Alzheimer's Association website, which is alz.org, then I was trying to find out more about what was Alzheimer's, what really is this disease, what is younger onset Alzheimer's, what is dementia, is there a cure, how long has this been around, how many people are affected by this, where can I go for resources, where can I go for help, what do I do with this? How can I handle this? Is there more people like me out there? Is there someone that I can talk to if I need to? And there I found the support line that's 24 hours a day. And there I found where I can go for workshops, where I can go and read things and postings that people have done, where I can find out what events is happening in the Alzheimer's Association, where I can see how it's affecting people around the globe.
So great resource, our website, and finally, the community resource finder.
Since I've been diagnosed with dementia, the one place that I know I can go to for assistance and help and support is to the Alzheimer's Association. There are people there that I know by name that I can contact if I'm having a difficult time, or if I'm struggling to find some resource, that they will provide that to me.
So the community resource finder, if you take away one resource, maybe two, I would say, take away the helpline and take away the community resource finder. So you can type in your browser bar at the top, you can type in the words community resource finder, all one word, .org. And that will take you to the resource finder. Through that resource finder, you can find neurologists in your area, elder lawyers, adult daycares, community centers. You can find when the next Alzheimer's program is, where are their support groups, where are their memory cafes. So these can be all great, helpful resources. And if you can register through the resource finder if you're online, or you can, again, call the 1-800 number. The nice thing as well, if you find those listings and you are unable to print them, or even if you are on not online, we have people that call every day, our 1-800 number. They say, I want a listing of neurologists in my area. Here's my zip code. And we will mail it out to them for free. We are happy to do that, or we were happy to email it. This is what we do. We want you to have the resources that will help you and your family. And there are many ways to join the fight. I believe this is our last slide, and then any questions I'd be happy to answer. So volunteers is a great way to get involved. We have over 140 volunteers, I want to say 143 in Greater New Jersey. We're trying to reach everyone in need, and it's very difficult as a small organization trying to reach everyone. It's just me and my supervisor as staff members. And with COVID, I'm only working part-time, so it's very difficult to reach the need. The need is very large. So if you would like to get involved, be a support group facilitator, run an education program like this, just come to one of our health fairs, pass out information. There's so many ways we need volunteers, and we would love to have you. Advocacy, very important. We advocate for people on a state and national level. So actually, if you are interested, again, you can find through our community resource finder. On Friday, Cory Booker is going to be doing an open session where he hears from people concerned about long-term care and what's been going on with COVID and how that runs into correlates with Alzheimer's disease and how it's made it so much more challenging for families. And if you'd like to attend, you could sign up. It's going to be 12 noon on Friday this week. And then Andy Kim is a representative, Burlington County, Ocean County. He'll be next week doing a session for veterans. And how they're affected and how Alzheimer's disease is related. And he'll be doing another session. All these sessions will be virtual. You are welcome to join and sign up again through our community resource finder. Really important we speak out, we advocate for people and the help that they need and the rights. Again, we talked quite a bit about the trial match and how important it is to get involved. And then we have walks to end Alzheimer's disease. And we have a longest day. The longest day is going to be this June, and it's going to be virtual. People do different events on that day to raise care and support and research and awareness and funds to end Alzheimer's disease. And then the walks are in the fall in September and October. We should hear shortly if they're going to be virtual or they're going to be in person. But definitely throughout the state, we advocate. They're our biggest fundraiser to allow us to, all our care and support that we offer are free. And this is the way that we are able to do so through these events. So if there's any questions for me, I'd be happy to answer them. Again, on the screen is that 1-800 number and our website. Please feel free to, even in the future, reach out. We're here to help.
Thanks so much, Nicolette. Yes, if anybody have any questions, please use the question feature in the dashboard, and we will make sure Nicolette gets them. So we have one question right now. Is there a true test for genetics?
So they can do a genetic test. It's really something to talk to your doctor about because it's probably not covered by insurance. I don't want to speak to every insurance company, but most likely not covered, and it's a little costly. And it will just tell you, again, if you have the genetics, if you were born with the gene. So it won't tell me the be all end all if I will get Alzheimer's. Because like I said, that I could have the gene, but it never expresses itself. I just pass it on. I live my whole life and never have Alzheimer's. Vice versa, I could take the test, great, I don't have the Alzheimer's gene, but because of other variables, I develop plaques and tangles in my brain, and I develop Alzheimer's disease as I'm aging. So something to think about, again, with your doctor. There is a genetic testing, but it won't concretely tell you if you will get it through your lifetime or not.
All right. A question about the recorded version of this webinar. Yes, this is being recorded. It will be uploaded to the New Jersey State Library YouTube channel probably tomorrow, and I will be sending a link out to everybody who registered that not only links to the video, but also to the recap page of this presentation. So next question, does insurance cover home health care aides?
It does vary insurance company to insurance, I would think. I can't speak to them all. So there is differences in Medicare and Medicaid. So one is needs-based, one is age and disability based. There are certain things that are covered by one than the other. So I would definitely look into what you qualify for. You know, if you're talking about like private insurance, you're talking about Medicare, Medicaid, I would consult with someone that, you know, maybe with the insurance companies, what you're entitled to, what your loved one's entitled to. And also with the Medicare, Medicaid, we have great relationships in New Jersey. Every county in New Jersey has an office on aging, and they're a great resource. You can always call our helpline, and we can tell you what we know as well. So I definitely look into that on a higher level, but I don't want to speak to each company or Medicare, Medicaid, and there's always changes going on. I don't want to advise incorrectly.
All right, a few comments right now. Two people said thank you. This was very informative.
Thank you guys for having me.
Yep. And another person said, thank you for the webinar today and many years ago when I was supporting my mom enter the moderate stage. You helped me and my family a lot. So.
Oh, thank you.
And we have another thank you come through. And another one, thank you very much for all the info. So, does anybody else have any questions?
And if there's anything, again, you think of in the future, Andrew has my contact information, and even if you you lose it or what have you, the 1-800 number you can always call and say, you know, I want to talk to someone locally in my area, or they can answer, you know, bigger questions as well. So we're always available if you think of something in the future.
All right. Oh, we have a few more questions coming in. Do you have webinars geared towards younger onset?
We do actually, and I have an amazing gentleman. His name is Jeff Berghoff, who was diagnosed younger onset, and he's teaching it, living with Alzheimer's, people with younger onset. So he's teaching it virtually on June 30th, from 1 o'clock. And you can sign up again through our community resource finder. He'll be teaching it on that day, and he's just amazing. And we also have him, we're privileged enough, he's teaching it in July as well. We're just finalizing the July calendar, but you can sign up June programs right now on our website and through our helpline.
All right. Do you know if there are bilingual support groups for caretakers or family members?
So I would imagine yes. So right now, virtually, you can join almost anyone, anywhere. So when you go on the community resource finder, on your left side, there is a panel of different ways that you can filter groups and things. If you check that you want to check virtually, and in whatever language that may be, Spanish, French, what have you, Korean, check that box and it will populate all the options in the other languages. Or again, you could call the 1-800 number and ask them. We just in New Jersey recently started collaborating yesterday. Funny that it's a question today. We just started doing programs in Spanish. And my supervisor also sometimes does them in Korean and other languages. We know that there's a high need, of course, across the board. So we're privileged enough that our national office came out with materials. We always have materials in other languages, but now the programming is actually going to be showing in Spanish. So we just started that yesterday, and you could sign up for those again through the website or through the 1-800 number. Right now, we're doing them all virtually, but hopefully when we go back in person, we will offer them virtually as well. So people have options that are in other areas.
All right. Somebody wants to know if you can do a virtual program for the North Brunswick Library, and can they promote your webinars to their patrons?
Absolutely. If you'd like to contact me offline, so my email is N as in Nancy, A as in Apple, V as in Victor, A S C as in cat, O at alz.org. You can email me or you can call through the 1-800 number. They can contact me and we'd be happy to partner. And you can, of course, we would love for you to promote any programs and services. The more people that are aware, that's what the biggest struggle we're finding is that it's not that people don't need the programs and services. Oftentimes they say you're the best hidden secret. They don't. They're just unaware that we're here. So the more you can share it, anyone, that would be wonderful.
All right. Someone asks, where can I find the link to register for the Healthy Living webinar for this Friday morning?
So you can register through the helpline, or you can go to, again, typing your browser at the top, the words Community Resource Finder, all one word, communityresourcefinder.org. When you get to that website, it will say, are you looking for support groups, education programs? Are you looking for resources in your area? And you can click community education programs and filter through. It will have all the different programs that are available. Our programming is at 9 a.m. On Friday, and we would be happy to have you.
All right. Hi, Nicolette. I'm back. Sorry.
That's okay.
I've been losing power in and out of this whole webinar.
Oh, okay. I thought it was me because I'm at my parents and they have horrible internet connection here. I lose it once a day at least.
No. Yes, if anybody has any questions, or let's see. If anybody else has any questions, if not, we can finish up. So. All right. Well, looks like we don't have any more questions. So again, thank you very, very much, Nicolette. This was a fantastic presentation. And we appreciate everything that you and the Alzheimer's Association does.
Okay, thank you guys. Stay well and safe.
You too. Thanks.
Bye.